Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Kwara State government cancels congregational prayers across the state ahead of Eid celebrations. Also bans vigils in all religious centers to curtail rise in COVID-19 cases. Over in the northwest, Kaduna State government seals off some social facilities and hotels across the state for violating stipulated protocols for reopening of businesses. And India records 49,310 new infections, its highest daily number of coronavirus cases. The African region is recording more coronavirus cases, now at over 780,000 and 16,000 deaths. Western Sahara has become the final country in Africa to confirm the presence of COVID-19, with 4 cases recorded there recently. The country is recognized by the African Union as its 55th member state, although Morocco claims it is part of its territory. In the meantime, South Africa has recorded 62.22% of cumulative cases, the proportion of the total in the WHO, World Health Organization, African region at 408,052. It's recording high levels of community transmission, just like Nigeria, whose numbers are put at 38,948. Using the same yardstick from the WHO, in Nigeria, the virus attack rate is 18.80 per 100,000 people, while South Africa has a much higher virus attack rate at 719.70 per 100,000 people. While the continent has recorded 445,113 recoveries, most countries in the region continue to see community spread of COVID-19. And in 24 hours, the Nigeria Center for Disease Control, NCDC, reported 604 confirmed cases and 20 deaths. The cases are from 20 states and the Federal Capital Territory. 246 cases were discharged as well in 13 states. 82 patients recovered in Lagos, 41 in Kaduna. Plateau recorded 36 recoveries, Edo 21, 18 in Rivers, 13 in Kano, 8 in Imo, Gombe 6, the FCT 5 as well in Kebbi and Ogun, and also Ondo states, and 1 in Ebonyi. Till date, the country's active cases stand at 22,054, while Sokoto and Kogi states have no active case of COVID-19 on admission. The Kwara State government has announced the cancellation of Eid al-Adha congregational prayers across the state, citing the rise in the state's coronavirus cases and the danger of large gathering worsening the situation. The government also announced a ban on vigils in churches and mosques, while restating the ban on concerts, clubs, beer parlors, bars, and in hotels. While briefing journalists, the chairman of the COVID-19 committee, Mr. Kayode Alabi, says that the decision to cancel the Eid prayers was a painful one, but necessary.
The government has consulted widely with religious leaders, labor leaders, transport workers, and market leaders, and has taken the following measures in the well interest of the people that we lead. A. Because of the huge numbers that are expected to gather for the special Eid prayers and the possibility of such gathering leading to spike in our cases and potential deaths, the government, in consultation with the Council of Ulama, under the Royal Highness, the Emir of Ilorin, Dr. Ibrahim Sulu Gambari, hereby cancelled congregational Eid prayers for 2020 cases across the whole states. This is a tough decision, but it was made in the interest of all of us.
To eradicate this virus.
Now, while the Imam Imale representing religious leaders re-echoed the worries of the state government, calling on people to abide by the directives, the State Commissioner of Police also expressed the readiness of the command to implement the full compliance of the non-pharmaceutical measures on COVID-19.
The only reason why we are still at this level of management is that our people are disobedient. If we follow all the guidelines that have been given by government, by now, this issue of coronavirus will have been effectively managed and will have been more comfortable with it. If not, that we have even eradicated it in this country. The government has already given out the guidelines that we are going to follow from now on, which includes compulsory wearing of masks by everyone. Violators of this regulation will be arrested and prosecuted under the Kwara State Infectious Diseases Regulation 2020.
And in Kaduna State, the government has sealed some social facilities and hotels across the state for violating its protocols for reopening businesses. Facilities such as hotels, bars, lounges, restaurants, swimming pools were shut down by the state's Ministry of Business, Innovation and Technology during an inspection of their facilities. According to Mr. Idris Singam, customers were eating in restaurants and bars. There were also the absence of physical distancing. There was also the failure to install hand washers at reception and other designated points. Meanwhile, the Kaduna State Internal Revenue Service introduced the COVID-19 task incentives to cushion the effect of the pandemic. According to the Executive Secretary of the service, taxpayers in the state will be given grace periods for the payment of consumption tax by the entertainment and hospitality sector and other incentives.
Quite a lot of people still go about business as usual. They go about it as if there was nothing happening. So there was a need to come out, or there is a need to come out, as directed by the COVID-19 task force, which is chaired by the Deputy Governor, to ensure that people maintain and keep to these laws and orders.
The national strategy for the coronavirus pandemic in Nigeria remains early detection of cases, prompt isolation and treatment, contact tracing, and more testing. According to the NCDC, speculations, especially about the increasing number of cases, dominated rumors this week. So how can we get past these challenges and bring the numbers down? We have Dr. Omede Ugu, a public health and project management expert. He joins us from Abuja studios. Thank you for joining us on the program. I'd like to begin with what we heard from the PTF yesterday, that the greatest challenge to the fight against the pandemic is a failure by many Nigerians to believe in the existence of COVID-19. Do you think that this is a challenge the country can get past?
Yes, thank you very much and for welcoming me to this program. It is a challenge that government can get over it, because for any type of disease in the context of public health, awareness creation and continuous awareness creation is key. And every opportunity that is available to create awareness, either using big or small events, is a welcome idea to do.
How would you say that things have panned out since the first case in February, almost 6 months now? Do we have a societal approach to the control of the coronavirus spread?
Yes. Since the first index case was, reported till now, like you said, 6 months has spanned. And depending on the national strategy and the length of the plan they have put in place, either on the interim basis or as a standby plan, ideally there should be what we call, for example, if it's a one-year plan, there's what we call a midterm review. And a midterm review is a technical strategy that looks for specific indicators or objectively verifiable indicators that tells on how far the government approach and plan put in place over half of that period has been effectively done. Besides that, the indices that comes out of this kind of report will also provide solution going forward. So looking at the plan that NCDC has, if it's a one-year plan for the target of 2 million people, for example, this is 6 months. The report, the midterm report, is long overdue, and effort should be put in place to produce that report so that they can tentatively tell us how far the journey has been.
Indeed, and we're also nearing the extension of the second phase of the lockdown ease. You know, the review that the Presidential Task Force gave us the last time, and I think that would expire sometime next week. And so in reviewing the modifications of the PTF in the last lockdown ease extension since the 1st of July, would you say that we've had, and this is in the case of domestic flights resumption, have we had a safe reopening of domestic flight operations?
Yes. Again, I don't know if the review mechanisms of government are all made public, but from the perspective of the PTF, in terms of airport reopening and then traveling by air, so far so good. I mean, from random reports coming from different medium, there had been successful travel through the air in all the phases of reopening. But that is not enough to say programmatically or in the context of public health that it has been successful. For reopening, there are some measures that are put in place by government, and those measures, most times, to tell tentatively, should be measurable and should be accounted for. And until that is done, one cannot just assume that the reopening is very, very successful. Because one thing is key and is obvious in the reopening of airport. Of all the measures that are put in place, there's no room for testing. And that leaves room for a lot of questions.
Should those measures also apply? Because we remember the position the government gave with students writing exams to wait until it's absolutely safe to do so.
Sorry, can you come again? I didn't get that.
Talking about the federal government's position on students writing their exams, if you remember, during the modification, they said it was okay, and later they went back on that. So in reviewing for the next, perhaps, lockdown ease measure, do you think that should be reviewed?
Well, in answering that question, what I think we should look at is some of the medium through which this COVID-19 can be transmitted. For example, if students resume, the student will eat food. What measure has government put in place in terms of food hygiene in the context of respiratory and cough etiquette or hygiene? Has government put anything in place? Because in the process of feeding, I mean, through some of the instruments that will be used and some of the facilities that will be used, there could be an increased possibility of infection. That aside, in school, there's also possibility of increased interpersonal contact. And there's what we call surface contact hygiene, like, putting on the electric switch for students that are in boarding school, the tables they use, the doorknobs, and some of the school facility that exposes them to contact. What measures have been put in place to promote awareness in these areas? Until some of these things are done, and then physical social distancing is also key. How is that going to be curtailed? Learning from experience in some countries that have called for resumption of schools, they were forced again to close down very quickly within a space of 4 to 6 weeks. So learning from that experience, what were the biggest challenge that they were encountered? Most of the challenges they encountered has to do with surface contact hygiene and how prepared at the school level and at the national level to roll down or roll in guidelines that could mitigate or reduce some of the possibilities of spread of the infection. Until this is done, in my opinion, it is a very, very difficult question to answer.
All right.
Because imagine what adults pass through when they are infected. Imagine if that should happen to children.
We definitely
Then
don't
it
want
would be
that to
very,
happen.
very debilitating.
All right. We'd like to thank you so much, Dr. Omede Ogu, Public Health and Project Management Expert. Thank you for joining us on the program.
Thank you, Millicent.
Like other state governors, as a result of the impact of COVID-19, the Sokoto State Governor, Aminu Tambuwal, today signed the 2020 revised budget. This was done minutes before the commencement of the State Executive Council meeting. According to the State Commissioner of Finance, Honorable Abdul Samad Dasuki, initially the 2020 budget was over 200 billion naira, but now it stands at 164 billion naira. He said the change was made as a result of the global economic meltdown occasioned by the outbreak of the virus. He also says the state government has approved tax reliefs and incentives for taxpayers and businesses to cushion the effect of the pandemic on residents. Now we have Dr. Deji Olaleye, physician from the National Health Service, Essex, United Kingdom. He joins us via Skype. Thank you for joining us.
Thank you for the opportunity, Millicent. How are you doing today?
I'm okay, thank you. I hope you're doing good as well. The UK Prime Minister, all right, the UK Prime Minister says the government didn't understand the virus in the first few weeks and months, and then he acknowledged that there were things the government could have done differently in handling the virus. I guess we can say that it's the same for a lot of leaders across the world, you know, learning about a new virus. But in your estimation, how would you say leaders around the world have done? And this is to, you know, flattening the curve of COVID-19 in their various countries.
I think definitely certain countries performed excellently well. New Zealand, for instance, so far seems to be the benchmark for assessing performance in controlling the effects of the virus itself in terms of spread and manifestation of diseases. I think primarily, if one saw the way New Zealand instituted a lockdown early in the day, I think that if there was anything that stood out in all the nations that performed exceedingly well, it was because of putting forward an early lockdown, instituting an early lockdown. So I think that was one thing that set those countries apart, countries like Singapore as well. So that was one thing that the UK could have done earlier, and I think they recognize now in retrospect that had they instituted an early lockdown, among other things, maybe the effect of the disease wouldn't have been as we have witnessed it here. In addition, I think...
Okay.
Yeah?
Go ahead.
I was about to say that the Prime Minister's recapitulation was significant as we prepare for a second wave of the virus. It was clear that certain mistakes needed to be acknowledged, and we needed to prepare to forestall similar occurrence in the future. So I think it was important for him to acknowledge that as well.
So in terms of the trajectory of the virus, we understand that weekly figures published by the UK government say the rate of infection has remained at the same level for another week. Is that progress moving forward or backwards?
Well, in one way, it's I think it's largely progress, because that tells you that, because in the same way we say that 2 weeks, what we see on the field is the effect of measures that were in place 2 weeks earlier. So it tells you that one way the R numbers, which is the rate at which new people are being infected, or rate at which disease is being transmitted, are kept low, and that we can continue in our present measures to curtail the virus. So I think it's a good thing. It is still progress. And in any case, it will take another 2 weeks for us to know how well we're doing from what we're doing today. So,
if you could, in a minute, tell us about what you've observed from Nigeria's response to the virus.
Well, it is. I think it was difficult for Nigeria. Nigeria is challenged by a health system that couldn't have been worse prepared. You know, the lack of infrastructure, not just the health system in general. So many things mitigate against against mounting an effective defense or an effective response to the virus. So there was really no way. I think the odds were stacked against us. Within the resources available to the NCDC, I think at the beginning they had just access to 20,000 test kits. There were limited isolation tests. There were limited isolation spaces if you account for the number of people in the country. In addition, even when people fell ill and required organ support, I mean, the number of ventilators available in the country were really low. So the odds were really stacked against us. And in spite of all that, probably a few things could still have been done better. I would say that the lockdown in Nigeria could definitely have been instituted earlier, as that was the only measure that could really protect Nigerians from the virus. It was just closing down the borders. And a few countries in similar position to Nigeria in terms of our economic status were able to do that and still achieve the good outcome. So I think Nigeria still has a lot to think about going forward, especially in the challenges facing the health system and possibly the whole nation at large.
We'd like to thank you, Dr. Deji Olale, a physician from the NHS in the United Kingdom. Thank you for joining us.
Thank you.
India has reported more than 49,000 fresh cases of COVID-19, with 740 new deaths, marking the country's biggest daily surge in infections. Meanwhile, as global coronavirus cases climb just over 15.5 million, the death toll reaching over 630,000, countries such as the Czech Republic join the likes of Germany, Spain and Italy to begin mandating the use of face masks.
India has recorded its highest daily number of cases with 49,310 new infections. This brings the country's total number of cases to 1.2 million. India is the world's third worst affected country and is currently experiencing a rise in cases after relaxing some lockdown rules. South Africa is closing its public schools for a month in a bid to curb the virus there.
The next few weeks will put our resources and resolve to the test as never before. And I call on all South Africans to remain strong.
Welcome to our COVID-19 press briefing today.
The number of confirmed cases in the country has surpassed 400,000. More than 6,000 people have died. About 30 million people will be offered the flu vaccine this winter to reduce the burden on health services coping with a potential second wave of COVID-19. British Prime Minister Boris Johnson calls it the biggest ever flu immunization program. Meanwhile, new rules requiring face coverings to be worn in shops in England have come into force to help reduce the risk of a new pickup in the spread of the coronavirus. The Czech Republic is following suit and is making the wearing of face coverings at indoor events mandatory from midnight. The country currently has more than 5,000 people infected with the virus, the highest number since the start of the pandemic. In other countries in Europe, such as Germany, Spain, Italy and Greece, it is already compulsory to wear face coverings inside shops. And finally, in Germany, people who return from high-risk countries will now be required to take a coronavirus test at the airport.
For more information on the pandemic, you can take a look at our website, channelstv.com. It has the latest updates. All you need to do is log on, access the news there. And there are several other stories coming in from Nigeria and across the world. I'm Millicent Nwaka. Thank you for watching. Continue to stay healthy and safe, especially this weekend.